Z-Pack, Z-Dog-MD, welcome to the show. I've got Gary Yost and Dr. Josiah Child. JC, that's right. So, Joe, you are an emergency physician, and Gary, you are a jack of every single trade.
No.
Computer, 3D programmer guy, but also filmmaker, documentary filmmaker. And the reason you're here today is we're going to talk about your documentary, which is called Inside COVID-19. Now, there's lots of documentaries in the world, but this is the first one that I've seen that was in VR using this. You reached out to me, sent me the film, sent me the goggles to check it out. And I was like, oh my gosh, I'm going to get COVID from these goggles, people. and I put it on, and I've not really used much VR. I've tried it once. I actually did a show where I first tried VR, and I almost vomited on myself. It was great. This was different because this wasn't playing a video game. This was experiencing an immersive thing, which we'll talk about. And I watched the entire thing with rapt attention. And the whole time I kept thinking, this is the future of how we convey with emotional resonance, not only history, but what's happening now. And I was so moved by it. I was like, come, let's talk on the show. So thanks for coming.
Yeah, thanks for inviting us.
Now, so you wonder, why is Joe, an ER doc, hanging out with you, Gary, a documentary filmmaker? How did you guys get connected, and what were you doing with this documentary?
I mean, it was just one of those really fortuitous and serendipitous events where we have a mutual friend, and she had told me, it's embarrassing to say this, but she'd been telling me that I needed to meet him for well over a year before the pandemic started. And I was always just too busy doing something else, or he wasn't around because he's only in the Bay Area occasionally. And soon after the pandemic hit, she told me that he was very sick. She said, remember that ER doc that I had been wanting you to meet? Yes. He's on death's door. Pray for him.
Oh my gosh.
So,
and this was the 2020.
Yeah, that was in April of 2020. He had gotten sick in the end of March, and she told me that, and I asked her about it. I found a little bit more about it. I didn't know him. And when he was starting to feel a little bit better in May, she told me that he was going to be coming back out to visit Seton Hospital, which is one of the emergency departments he manages. And she said, he would just make a great subject for your Wisdom VR series. And I said, yeah, absolutely, let's meet him. And he came by the house one day. We sat outside on the patio with masks on in May. And he was just really a few weeks from getting well enough where he could walk around. And my directing partner, Adam Lofton, was there. And we instantly saw that we had a story that was unique and that it encompassed both the physician side and the patient side of the pandemic.
So this is what's amazing is Josiah was there in the early days of the pandemic, seeing this stuff happen. And you're the kind of star of this documentary. I hate to say it, brother, because my relationship with the ER is tenuous at best. As a hospitalist, at any point you could admit something to me. We could argue over what the K ought to be and whether it should go to psych.
You said what the rectal showed.
Whatever the rectal.
It's usually the kind of question we get.
I am not admitting this patient until some emergency staff does a rectal exam. Exactly. So you when I started watching the documentary, first of all, it's crazy because you're immersed instantly into a 3D world that's the hospital. And I'm sitting in the room with Josiah, and he's talking to me. That's what it feels like. And I'll have you just like slide a little bit over there because our camera line, man, I'm not set up for this, brother. You're the filmmaker.
Oh, hey, this isn't my studio.
That's see, this is what people say when they're trying, I have no responsibility for the quality of this. So I'm sitting in the room with the goggles on. I'm wearing the thing. I'm sitting in the room with Josiah, and he's telling me his story, first of the pandemic, and then it becomes about him. And the heart rate goes up. I smell what it's like in the hospital because I'm there, right? I'm looking around because you can turn your head and it's a 3-dimensional, 360 sphere of experience. I see a nurse is stationed there. I see the door. I feel the claustrophobia of those ER rooms. At one point, when you become the patient, I'm like in there, like stressing with you. It is the most powerful thing. It was crazy. And you lived it. So what's it like then when you watch this back, you talking about this experience? We're going to talk about your experience, but what does it raise any sort of feelings with you? You almost died, brother.
Yeah, it absolutely affects your piliary muscles. I mean, you feel your hair on your forearms and your skin go up.
I have hair on my back. It was standing up like a porcupine, dude.
Yeah, so that's the feeling. It's chilly. It's chilly.
Yeah. And so maybe, Gary, I want to ask Josiah, like, just to quickly recount, because you documented this in a beautiful way that's so visceral. And people, after watching it, I remember I took the goggles off and I emailed you right away. And I'm like, this is the future of media. This is how it's very hard to watch what you showed us, which was, by the way, apolitical. Like, none of this like shaming, none of the BS, just here's what happened. And using Josiah as an example of like, hey, here's a doctor who got severe COVID, had horrible things happen, pulmonary emboli, very sick. And you watch the whole thing, you see what's going on, and then you come away going, okay, where's the vaccine? How do I get that? Or what can I do to prevent this from happening to any other person? Anybody who thinks the thing is a hoax or whatever, they've been influenced by whatever's online, they're well-meaning people that just they haven't seen the right stuff. You can't watch that and go, oh yeah, no, this is the flu, basically.
Well, I'll just say one quick thing. We've gotten quite a few people who've told us that they wish they could put headsets on people on the street, just grab them and put a headset on and show it to them because it's such a visceral experience.
I would just say, I mean, I've led many, many town halls of healthcare workers, and the early days of the pandemic, they'd pull the nurses and it would be 15% wanted the vaccine, 20% wanted the vaccine.
Yeah.
And when you actually, the animation is so beautiful, and you show people what mRNA is, what a mRNA virus is, and how the vaccine works, how it doesn't touch your DNA, doesn't touch the nucleus of the cell, doesn't involve the Golgi apparatus, and you show them how it works. It's so relieving to people's psyche to have actually be able to have a vivid imagination of the molecular biology. It went from 20 to 99% every single time.
Can I just add something to that? Because I don't think your audience really understands that part of the documentary, we go into the cytoplasm of one of his epithelial cells, and you're inside the headset, and you are now embodied inside the cytosol of your cell. And so, Josiah, originally we would talk a lot about how the virus is an invisible thing, and people really don't understand invisible things. If you can't see it, it kind of doesn't exist. And we've had lots of conversations about this. So it was very important in making this documentary that we made the invisible visible. And so you see what happens when membrane fusion, brings the virus into your cell, and you watch it replicate.
Go ahead.
Well, I mean, because I think, you can talk about logic and studies, and that affects people's ideas, but it doesn't affect people's belief. And when you actually show the theory, that affects people's belief.
Okay. Yeah, there's a lot here. So, okay, couple of housekeeping things that are important. Yes, it's a fantastic voyage that you guys do where you put us into the cell in 3 dimensions. I can look around. I see transcription happening. I see this virus fusing. I see the ACE2 receptor binding. It becomes viscerally real.
Yeah.
None of that would mean shiznit if it didn't come with an emotional connection to somebody who actually suffered from COVID. And that's what ties it in, because you mentioned belief. You don't change belief with logic or rationality. You can influence it, but you change it with emotion, and then you direct with, and so it was really, and I got to say this, you're nominated for an Emmy for this thing.
We did get nominated, yeah.
And so somebody else figured out that this is legit. It's not just me being crazy, right? And because I remember when you first see the scene, you see the Earth, and then you turn around and there's all this coronavirus floating in space. And it's such a stunning feeling that makes it real. What you can't see, you don't care about. You know, it's just like if you've never met anyone who's had COVID or been very sick, the thing's a hoax until proven otherwise, because you've lost your job because everything's been shut down. Your kid can't go to school. It's not real to you. Then you're sitting in the room and Josiah's like, yeah, that's when I must have caught COVID when this thing happened. And then your wife and your family are there. And what's crazy, okay, so this is what's crazy. You can't be coached because no filmmaker can be in the room with you at the time. How does this work? Because you'll see, you look all around. There's no Gary there going, hey, Josiah, tell him about the time you almost died. You're alone with your family and a camera with like a billion lenses on it. How does this work?
And I tell you that at the time, I'd sort of recovered kinda. So every time there was any sort of lines, I had to really think, can I get all the words out?
So you had like longish COVID.
I had, well, I mean,
just recovery.
Yeah, I mean, I think there's, yes, partially to that, but also just the tissue damage to the lungs just took a while. So, there were multiple pulmonary emboli and infarctions and stuff like that. It just took a while to recover.
Okay. Oh man.
And the nervous system stuff is.
But I mean, to get to your point, sorry, he did not seem like he was recovering from COVID when we were shooting this film. He was totally on top of it. And he's only admitted to me now, months later, that he felt shaky during that period, but we could have never told.
How we were filming post night shift. How did you not think I was shaky?
He's post shift now. Look at him; he's a mess. So
how did that escape you?
He knocked it out of the park every time. And I mean, I want to give big props to my co-director Adam Lofton, who so. Stepping back a little bit, because you talked about those scenes with his family, which were actually very difficult to film because they couldn't be manipulated or edited in any kind of traditional filmic way, because we capture these experiences that are uneditable. And so in the first meeting, he told us that if we were going to make this documentary, we had to come to New Mexico and film at his house, film at his hospital there, and film out in the desert where, on the way to the hospital, and be with his family. And we were in the Bay Area, and it was the beginning of the pandemic. And both Adam and I were extremely reluctant to travel at the time. In fact, I mean, as you know, I'm asplenic and I have all sorts of immunocompromised.
You're a show in yourself, Gary.
And I'm getting phone calls about the outbreak in San Quentin, and all the patients are coming to our hospital while we're talking to each other.
Right. He's in San Quentin, and then he's getting patients from San Quentin, and I'm like, I'm not going to Santa Fe. So Adam, who's much younger than I am, decided I will do it. This is a really important documentary. And we hired some crew in Santa Fe, and Adam lived with the family in Josiah's guest house. And that process of living with the family for 3 or 4 days before shooting those scenes in the living room gave Adam, who's an incredible director, he's much more sensitive to people than I am. I'm more of a nerd. But he managed to work with each member of the family. So when it came time to shoot those scenes, he just said, you're first, you're second, you're third, just speak your truth. And that's how those things came across. And one of our story consultants was extremely skeptical that we were going to be able to get authentic performances from Joe's family, and was blown away when we got back and showed him the footage.
Okay. So this is what I felt when I was sitting with your family. Authenticity. I was like, these are real people telling a real story. And you know what? I'm not going to lie. I was looking around at your house going, I need to go be an ER doc because this is pimp. All right. It was really cool. Beautiful Southwest kind of style. I was looking at the details, absorbed, and then turn back. And then your wife is telling a story. Your son is telling a story. Your daughter's telling a story. And you're just riveted. You're pulled right in. It's the medium. And I got to say this, we're sharing a link, which you've never shared because you know that converting all of this immersiveness into a 2D YouTube video is not going to do it justice. But we do want our audience to get a sense of what this content is.
Yeah, that's right. We've never shared this because the cropping and transformation from this stereoscopic 360-degree view to a little frame like that takes about 90% of the impact of the medium away, but you can still get the story.
Yeah.
And I didn't want to go on the show with you without showing people anything, so I acquiesced to myself, and I hit the public button on the YouTube link today.
Man, it's awesome because I'll tell you, I went and looked at that clip, having seen it with, and this is an Oculus, yeah?
Yeah, it's a Quest.
A Quest. Are there other VR companies that?
Oculus actually funded
Okay.
this project, and there are no other companies that have an ecosystem for delivering content in a mobile headset like this. So they're still the only ones.
And so, yeah, before we follow up on that, I just want to show you guys this. So, you put this thing on, it's got it's a little sensitive, so you have to get it just centered right. And once you do, everything pops into this beautiful immersive thing, and you sit, so you're not walking around. So the whole vertigo thing is much less of an issue than with, say, video games. Mm-hmm. And because I get a little vertigo with the video game VR, but with this, it was not a problem. And looking up, looking down, the audio is beautiful, especially if you have headphones, and it's just immersive. Then I went and looked at your clip on YouTube, and I was like, okay, the story is there, but there's some emergent phenomenon of that 3D immersion that disappears. And so it's important that people understand that when they watch the clip.
Can I geek out a little bit
Please
about
do.
this? So what happens when you put the headset on, you become re-embodied in the spot that the camera was in when you made the shot. And I'll show you the camera in a little bit.
Yeah.
And you become disembodied in the spot that you are physically in. So all of the normal proprioceptive impulses that you have kind of disappear, and you become this ultimate voyeur. It's this tremendous feeling of invisibility. Mm-hmm. And because you don't have to deal with any of this proprioceptive stuff, your brain rewires instantly to become much more sensitive to what you're seeing and what you're hearing. And I mean, to put it simply, your bullshit meter gets amped way, way up, and you can detect any inauthenticity instantly. And there's no other medium like that. I mean, you can't look away. You're in the scene. It's three-dimensional. It's stereoscopic. It's all around you. And yet no one can see you. So your ability to study him or his family or the radiologist or anyone, it's that game that a lot of us played when we were a kid. Would you rather fly or become invisible? And I always chose invisibility. And it's this incredibly powerful feeling. And that's what this headset gives you that no other medium can give you, which is why when you watch the YouTube link, it's just like this, whatever, little crop of a wide angle scene, and you get none of that.
I can be much more curious.
Hmm?
You can be much more curious and explore things.
That's right.
So, okay. And I don't know if we've talked about this, you and I, offline, but when I sat in that sphere of experience, very quickly, you're right. You're disembodied. So you don't feel the proprioception. You don't feel the body sensations. But so all your attention, all your consciousness, awareness goes into visual and audio cues, and thought even starts to calm down. Mm-hmm. And what happens is you lose yourself in the images and sounds and the experience. That is the goal of many spiritual practices, actually.
It's also the goal of storytelling.
Exactly. Lose yourself in the story. Where is the self? Nowhere. There's just the story. When you said the bullshit meter goes through the roof, 1,000%, because you're so focused on what, say, Josiah's saying, or what his daughter's saying, or what his wife's saying, that if there were any inauthenticity, you would hone in on it like a missile. That's why I thought it was so great, because you put the camera there, your co-director is brilliant. He gets to know them. They're comfortable. They're doing their thing. Dude, I tell you how hard it is to get people to do their thing in an interview, right? It's like you guys do it naturally, but so many people are just like, they're a different character. So to get, that would never fly in this medium, because people would be like, bullshit. Instantly. But that's the transcendent nature of the medium. That's why I felt when I got it, I took it off and I finished the documentary. I was like, okay, I've seen something that's transcendent. Like, I feel like, and I'm very nuanced about COVID. I'm like, masking, it's a freedom. And I watch this and I'm like, put a mask on everyone, vaccinate everyone, shut it all down. You know, I mean, it's not quite like that, but it is this visceral, like, oh my God, this is a horrible disease. And and seeing the molecular pattern of it actually triggers almost a disgust response. You're like, I don't want this thing infecting me.
Yeah.
And so it's brilliant. And that's part of the reason I'm so glad you could come and dude, you're like post shift. How long was your shift? Was it an 8 or a 12?
It was an 8. Started at 6.
Oh, man, I don't even know how you're doing this. But tell me about the COVID thing with you, because you were one of the early, I mean, this was March of 2020?
Mm-hmm. Yeah. So, I think, we talk about in the film, it was just so ironic. And here I am, like, helping multiple hospitals, do their protocols and everything and set things up, because, what happened is so much of our expertise in infectious disease and, intensive care medicine has become following recommendations from national societies. That's the way you think. You know the recommendations better than anyone else. And that's how you get things to happen in your hospital.
Right.
And all of a sudden, there's no recommendations. It's not. And what was really, I have to say, amazing is, I think this did happen across the country, is that emergency physicians were kind of like, undeveloped children. And
I didn't say that, guys.
We still
he said it.
Believe that we can be heroes and we can go into the unknown. And it was a strange phenomenon that, we felt, okay, here is a global altering disaster. When do we start?
Yeah.
I mean, it was universal in the profession. Not everyone, but that was the basic instinct. And it was neat to see in the hospitals, people step up into leadership positions saying, we have imperfect information. We have to make a decision. And so in some sense, we talk about it was a very exciting time. Yeah. And, we bonded together intellectually across the country. We'd have, meetings with Scott Weingart and all those kinds of folks on the East Coast.
Scott is so brilliant.
Force of nature. Right?
Yeah, he's a force of nature. He's a friend too. He's just wonderful. Yeah.
And but then all of a sudden, while protecting the front line, my son's girlfriend goes to a wedding in Louisiana, and he comes home, and I remember it clearly. He's 17. He comes over and he, says, "Oh, Dad, I'm feeling a little down." He sits in my lap. And of course, I mean, what are you going to, your dad, your son comes and sits in your lap. I mean, this is like the best thing. It's better than a puppy coming out. This is fantastic. Yeah. And, so one of the themes, I think, in the movie is that the evil nature of the virus is it's transmitted by love.
Yeah.
Right? Our tendency to care and feel compassionate and, be in contact and exchange feelings with each other, that's what the virus lives on.
And that's why I think people have it's one of the reasons people have such reactions to locking things down, to wearing masks, to distancing. We're not designed for that.
No.
This thing knows how to hack everything we love and care about.
On the best side of us. That's what it thrives on.
Oh, man. Well, and that's really well put, by the way. I think understanding that would help us understand why there's resistance to. Right?
Absolutely.
Yeah. So yeah, and I don't want to ruin the movie, because I think it's storytelling with visuals and immersion about your experience. But suffice it to say, you got very sick very fast. Your family had to basically drive you because there wasn't an ambulance, and your SAT was like, what, unmeasurable or something?
Yeah, the pulmonary embolus hurt.
Oh my gosh.
I was doing okay. It was like SAT was 89%. We're at 8,000 feet, so I've got the oxygen. I think everything's just fine. I remember getting off the couch to go walk over to the bed, and you've got IL-6 pumping through you, so your muscles are all wasted, and you walk over there, and then boom. I mean, it hurt, and I just felt my heart rate go up to 100 and whatever.
Did you know right then? Or did you have a suspicion?
Well, when I took my first breath and went,
You thought PE?
Within about 5 breaths. I mean, I didn't get it the first
Still
time.
Still pretty good diagnostic.
It started beating on me.
I want to make a comment about what your friend and the radiologist, Steve Abaddon, said. He said, the PEs were really bad, but those weren't the things that I thought were going to kill him. It was the inflammation and lung consolidation.
Consolidation
I
everywhere.
mean, Steve basically said the consolidation was so horrible that that's what he was most worried about.
All that VQ mismatching, and it's a mess. And what's
Those are
amazing,
the infarcts, yeah.
yeah, the infarcts, exactly. In the film, we talk to that radiologist, and they fly us through your lungs with a 3D reconstruction. And by the way, my wife is a chest radiologist and watched the film and was like, "Oh wow, that was great." Yeah, and she's pretty cynical.
Yeah.
And so, yeah, it was really impressive. And kind of it really highlighted the struggle with, there's such a weird virus causing these clots, inflammation, all the weird cytokine stormy stuff, all of that. And yet, and yet we were treating it because we didn't know what we were doing. Like, is this flu? What is that? I don't even understand. It was
Well, I mean, he was hacking up pieces of lung because of all the
sounds
infarcts.
right. The infarcts, yeah. Oh, did you have any IR procedure done for any of that?
No, I was very proud of my right ventricle.
IR means, by the way, for your audience, IR is interventional
radiology. And as far as what his comment about the right ventricle, which pumps blood through the lungs, is often the one to show strain or failure when you block up lung circulation in the form of pulmonary emboli, clots in the lung. And so the fact that your RV was still cranking was enough to not indicate you needing a something put down there to roto-rooter it out. Right. So I'm glad that you didn't die. That's all. I'm glad you didn't die. Now, here's a question, and this is kind of related to that. Did you afterwards get vaccinated when the vaccine came out?
Oh, yeah.
Yeah. Now, how was that for you? Did you have a big...
Terrible.
Tell me about it, because a lot of people ask this question. I had COVID. Should I get vaccinated? Yeah.
So, yeah, first I'm thinking, okay, so if I get the vaccine, am I going to get another blood clot?
Right. Because we didn't know.
We had no idea.
We didn't know, yeah.
So, okay, is it time to go back on Eliquis to take the
blood
vaccine?
Thinners. Right.
Is it, do I take an aspirin? So there was just the physiologic concern. Nobody knew, And so, and then it was kind of the PTSD of now kind of remembering it. And then there was the actual terrible feeling of 3 days of fever. And, my wife saying, yeah, you talked about kayaking to school last night for 12 hours.
Wow. So you were just out of it, huh?
Particularly with the second shot, right?
Was it the first?
It was about the same. Yeah,
and which did you get, Pfizer or Moderna? Pfizer, yeah.
Yeah.
That makes sense because you're reactivating the immune component of that. And it tells you something about our immune system and separating out how much of this is our immune response and how much of this is direct viral effect.
Right. And also with the vaccine, there's the innate immune response that you get right away, right? So complement all that. And then the adaptive immune response. And, that you could cycle through.
Yeah.
But yeah, and then to get the second vaccine, I was like, oh, really?
But you did it. Why? So I think your reasoning might help other people understand this decision process because it's not the same for everyone. But what was your reasoning in getting the vaccine again? Were you so nervous about COVID? Did you think you weren't protected from the natural infection? Or were you just, help me understand.
I think it was just because my position. One, felt that I needed to be a model behavior.
Yeah.
That was the part I was dragging myself. That wasn't really helpful reasoning because, and that would require adult reasoning. So, really? And then I think it was also that I felt like the moral part. What if I was a vector for somebody else getting sick?
Right.
And so, in retrospect, with Kantian reasoning, how would I have wanted myself to behave? And it was obviously if I was a vector for somebody else and hadn't done everything I could have to prevent that, that would be unacceptable as a physician and person that's in the public. Yeah.
Yeah, and I should put a pin in that science on that. People seem to feel that the vaccine does not prevent you from spreading the disease and you're just as likely to get infected. None of that is true, actually. So it does reduce infection rate, just not to zero, obviously, and you can still get breakthrough infections. And it does narrow transmission window if you do get infected because you may be more likely to have an asymptomatic case or a non-severe case with less viral load. So it is important, especially for healthcare professionals who seem to be among the reluctant, many of them.
But I think it's interesting if you look at sorry to get into COVID data, but if you look at the data in England where they spread the 2 shots out because they pursued a strategy of everybody gets the first shot first. So it's spread out 8 to 11 weeks.
Right.
Even with the Pfizer vaccine,
They did
you're
well.
getting above 90% resistance to any infection.
Okay, so this is really interesting because there is this feeling that maybe a longer spread is good, which again is part of the rationale for why they're talking about booster shots too. Because when the shots were so close, and sorry, Gary, we've hijacked your documentary, but
no, this
hey,
is the
this
meat
is a
of what
teachable
it's all
moment.
about.
It is. It really is.
Absolutely.
It really is. For some people, it might be that especially elders, people with immunocompromised, that original spacing of 3 weeks for Pfizer may have acted more like one shot, one priming, and the booster may be the second shot for them. I was team Moderna, so it was spread out by one more week and a higher dose.
Cool name.
Hey, Spike Vax. Dude, come on, bro. You're ER. Come on, hit me up here. So Spike Vax.
Community.
Yeah, okay, this is like, it's just like, hi, I'm Community. Like you could just see the commercials for like Pfizer. Community, like they're walking through a meadow and holding hands and dancing and this kind of thing. And then it's like Team Moderna, you get Randy the Macho Man Savage, rest his soul, to come out and just be like, Spike Vax! Snap into a Spike Vax! And, it's a different, anyways, I digress.
But to your point, I saw one of your videos recently where you said, well, it is important to ask questions.
Yeah.
And it's true that there were mistakes made in rushing the vaccine, namely the spacing.
Right.
And that's something that's now something we can adjust to and pivot to and correct. And so I think that it is important to not think vaccines are perfect and the original regimen is perfect. No, now we're learning that spreading it out probably is a little better.
Right. What I really, can you show us the camera?
Sure.
Yeah,
It's
because
right here.
I gotta say, like, I was so taken aback by the experience of watching this thing, just the tech of it, and oh my gosh, may I hold this thing just so I can get it?
Sure.
in focus?
Here's a nice handy
great.
handle for
Look
you.
Dude, look at this thing. Exterminate, exterminate. It's like a Dalek, dude.
He knows Doctor Who.
Yeah, a total Doctor Who, man. This thing is really remarkable. So each of these is a camera.
Yeah, there's 10 cameras.
And there's a controller, and the thing like hooks up on whatever a stand.
It's a monopod.
Monopod situation. Okay, got it. And what's amazing is it's 360 immersive. These are each probably wide angle with some overlap.
190 degree FOV.
So field of view. And is it stitched together by a computer ultimately? Like how do you stitch this?
Singers, sewing machines, and there's the new ones now. They're really good with that.
It's together by his brain.
Oh my gosh.
So it produces 10 separate videos that have quite a bit of overlap.
Right.
And because of all that overlap in the computer, you can identify, which pixel would be seen from the left eye and which would be seen from the right eye. And you generate 2 completely different, what we call equirectangular projections, and one for each eye. And then, when you put those together in the headset, it creates a stereoscopic field. So there's a lot of magic sauce, a lot of human sauce that goes into this. There's no computer that can automatically stitch these things without lots of funky errors. But
I see.
One of our special talents is that we understand 3-dimensional imaging really well, and we produce a very natural field.
Turns out, for those who don't know, Gary's kind of a legend in the 3D computer space. The niche.
Space.
It's kind of like my level of fame. Like I'm like nurse famous, and just one nurse. Her name is Beth. She loves
Doctors
me.
who think they're nurse famous.
I love it. I'm not even nurse famous. I'm nerd
You're
famous.
nerd famous, yeah. Which is actually something I've aspired to since youth. Yeah. So, Joe, when you are looking at this, right? What is that like? It's sitting on a monopod, right? And you're talking. How do you lose yourself when this is there? Like, and just be you? Is it natural, or did you have to work at it a little? Or
yeah, I guess I thought of occasionally sort of, talking to the camera kind of thing. But mostly I was just trying to breathe and not choke when I was speaking. So,
Got it. Yeah.
there's a lot of internal kind of organization going on because I knew I had to make each sentence come out and have a period at the end of it, and then go on and do the next one. So there was still some breathing organization that happened. Had to happen.
What we asked him to visualize was the person who is going to be in the headset embodying that space. And I don't know how much you were able to really do that, but we would really
felt like it.
We start every session, every time we roll, we talk about that there's a person in that space. And we're very careful about the eye line. So when you're in the headset, you feel like you're looking directly into his eyes. It's really a game of fractions of an inch.
Yeah.
You don't put the lens at the eye line, you put the lens right there. And it's just, there's all these subtle things about it.
The other subtlety that I noticed as somebody who does this is not this, but this is use natural light.
Available light. Yeah.
Available light. So you weren't lighting it. There wasn't all this artifact. It was just this thing on a monopod.
No. Well, it's, again, it's reality, right? We're capturing reality. There's no grip and lighting gear in reality. We pay attention to where are the windows and what time of day is it and where's the sun and, what practical lights there are, like lamps in the scene and things. We pay a lot of attention to that.
I mean, the experience as the viewer, somebody who's like worked way too much in a hospital, is I'm there in the hospital. I'm looking around. There's a nurse's station. I'm looking around. There's the door of the exam room. There, I'm in the radiology suite. There, it's uncanny.
There's a really interesting aspect of that in that one of the scenes, Joe is attending to a COVID patient. And, we could never be in that room, right? I mean, that would have been, it's a very small exam
so that was
room.
Real? That patient?
Yeah.
Oh, wow. You know what's crazy? I remember that scene. And I was like, man, that feels really real. They got that person to really look like a patient.
He's on a CPAP machine.
Oh, man.
Well, it's not actually connected to CPAP in that moment.
Right. But the thing was real. Yeah.
But
and so we put the camera inside that room, but we're outside the room.
Wow.
So the camera has a special ability to go in unsafe places.
Right. Yeah. You could put it in like a nuclear reactor.
It was basically before COVID, our TB room.
A TB room. Yeah, exactly. Negative pressure. Right. Wow.
Yeah.
Man, that's really cool. And so how do people watch the documentary in the first place? Like, how would they do this? They'd have to get an Oculus and then...
they've sold about 10 million of these now. And most people, that's not most people, but many people know someone who has an Oculus Go or an Oculus Quest, and it's freely available on what's called Oculus TV. And you go to our website, which is www.insidecovid19vr.com, and it has the instructions. If you have one of these headsets, you go here, you can click on this, and it pushes it right into the headset. It's all free to watch. And
awesome.
Yeah, it's easy to watch.
So this is an excuse to get one of these things at last.
There's a lot of great content. In addition to our other pieces, there's, climbing up Mount Everest and swimming with whale sharks, and there's tons of great content.
When he sent me the thing, I'm kind of like, recently, here, I'm going to hand you this before I break it. It's probably like $30,000.
I'm sweating here.
Yeah, I know. I'm like, well, so the thing with this thing is, hey, catch, Joe. When I was using the headset, I scrolled through some of the other content that you've created, or that you had on your headset.
Yeah, that we've created.
That you've created, right. And one of them was an interview before he passed with Ram Dass, who's this legendary, figure in sort of, he wrote Be Here Now. It's a very
50th anniversary this year of Be Here Now being published.
Wow. And so he had a stroke and was in a wheelchair or fairly immobile. And you were there probably at his house, was it?
Yeah, his house in Haiku on Maui.
It looked like it was in Hawaii. And he's talking about what it's like now and, his, we're loving awareness and so on. And man, it was like going and doing a retreat with Ram Dass. Like it was like the potential of this thing for every kind of pursuit, whether it's, spiritual awakening, whether it's understanding COVID and motivating public health behavior, whether it's teaching about the pathophysiology and molecular biology of this thing, which by the way, when I first met Gary, he came over, showed me this stuff. He's talking molecular biology at a level that I'm like, okay, you need to pump the brakes because I majored in this in Berkeley and graduated in 94. All right. I barely remember what a molecule is. Right. And he's like facile in it from having done all this. It's really powerful.
We had to do a lot of research in order to get that visualization correct. And it was so interesting to me to learn that much that I've actually put a team together to create fully interactive molecular biological experiences of how the immune system works, the adaptive, the innate, how viruses work, how vaccines work. And we're looking for funding for that project right now. Nice. And it's a world-class team. I mean, this is the best group of cell biologists, visualization people on the planet. And we can do something that nobody's ever done. We can show people things that they've never seen before by putting them in the headset. That we also can create 2D projections for a laptop and, like a traditional kind of video game environment. So if you know anyone who wants to get involved with us, I've got the team all ready to go. And once we do a prototype, we feel like we have a good opportunity to get funding from some large public sources, but we need to put a prototype together.
Yeah. So I mean, right. Could you imagine medical school, learning basically any kind of physiology at a molecular level? It's like, come on, using the thing be so awesome. Yeah. It's immersive, man. And the thing is, look, I try to teach on the show. I don't even use visual props. I'm trying to create a memory palace by talking through and using my hands. And then you watch this and I'm like, I'm out. This is in 5 seconds, he kind of shows you how an mRNA vaccine might work, right? The right. potential for that. Yep. Easy. Whereas I'm like, okay, so messenger RNA, let's go through this. I could squiggle on a board. It's not going to do it justice. Seeing it in 3 dimensions in the cell, right? It's pretty remarkable.
Well, I mean, once you're there and witnessing what's going on, I mean, that's what this medium is also really all about. It's being a witness to whatever you're seeing.
Right.
And so it's one thing to witness him going through his personal struggle. It's another thing to witness what's inside of you at the tiniest level and how that really works. And, it's things that we've never seen before.
Yeah, it's great. It's a combination of imagination and actually realistic depiction. And it's so viscerally immersive. Again, I keep coming back to this visceral. It's that thing, like you said, you can't, belief is a very stubborn thing. And to really move it, you have to motivate both emotion and mind. And that's, I use the Jonathan Haidt analogy of elephant and rider, right? The thinker and the feeler.
Oh, yeah.
Yeah. And this does both. That's what I love about it. It's a really beautiful medium.
Yeah. And given what a pivotal moment the pandemic has been for our culture, our civilization, our species, I don't think there's any better way to capture a time capsule. Which goes into this subject that we've talked about in the past regarding how we've forgotten so much of what we learned from past pandemics. And our hope is through this medium and other people's work that we can create these time capsules to inform our children and their children, on this, very witness-based level as to what happened now.
Well, I was just going to say that I think one of the experiences with using this is it's also kind of strangely calming.
Yeah. You feel a little empowered after watching it.
It's not like watching Mission Impossible. It's not like, going through your Apple News feed. It's somehow you get into a more contemplative kind of mode. And, it kind of reminds me of a friend of mine who's Russian says, you can either be stupid and energetic and be successful, or clever and lazy and be successful. You just can't be energetic and try and be clever too, because you're going to outsmart yourself.
That sounds right.
Right. So, this kind of calms your nervous system and kind of you get a more thoughtful mode when you're getting the information.
I hate to keep harping on this, but it's the loss of self, I think. It really is, because the construction of self that we create minute to minute to minute to minute is a series of beliefs and energetic patterns and memories and projections. When that relaxes, we are so fundamentally present that we experience unfiltered reality. And this feels like that. It's a pure witness.
I think your word relaxes is a really key word because, even right now, when 3 of us are talking, I'm wondering, do I have a booger in my nose?
Sure.
Do I have food in my teeth? Am I going to say something smart or witty or whatever there's this tremendous amount of pressure that's subtle that we're just used to because we've lived that way our whole lives to, I don't want to push it so far and say be performative but there is this is
always with humans.
It's and you put on a headset and all of a sudden
it's gone.
It's all
gone.
It just goes away. And I would say one other thing, you can't look away from the experience.
No, you're stuck.
Which is a powerful thing.
You turn around, you're still in the room.
Yeah.
And here's a little piece of thought that I had about it, which is if you're going to do it, it may be something where either everyone's doing it together, so they're all in that situation, or you're alone. Because the self-conscious mind will start to create a self that imagines someone's looking at them with the goggles on.
True.
When I watched it, I was by myself. When my wife watched it, she, every now and again, my kid would come up and smack her or something, and it really breaks the spell. So it is. It's that loss of this kind of thing, which, by the way, you can lose through practice, right? But boy, that's a path, right? Mm-hmm. This is a beautiful hack to get you there.
There's an interesting kind of ironic aspect of that is that our goal in creating these experiences is to create connection between people. What you just said about how you want to experience it alone because you don't want someone looking at you because you got this goofy thing on your head. However, I'll ask you, did you feel more connected to Joe to the world even?
All of it, yeah. When you pan out and you're seeing the earth, like I just love coming out of the chest. It's a weird experience. It's a connection because you're again, your self is gone and you're everything. So everybody is you. That's how it feels like to me.
Ram Dass.
It all comes full circle, right?
Yeah.
That's what he was saying. And so that's what really struck me is you can reduce it to, it's a submersive VR. VR was like such a catchphrase for a minute. I think that doesn't do it justice. Like this, it's very hard to watch a regular TV show on a flat thing when and some things lend it to it. So
Absolutely.
I must say, what's sort of weird about it is that, at least when I was sick, my connections to people changed. Like it's not, it's not, feeling, my passion, your passion, whatever. It became very kind of ethereal and intellectual. My connection was with my colleagues, with Steve Abaddon, who's 1,000 miles away, reading my chest CT, and it was beautiful in some ways, but not the way we normally live. And to see the House of Medicine, we talk about in the movie, kind of wake up and start to communicate, not with no more insurance people, no more lawyers or whatever. Here's the threat. Let's find a solution together. It was, kind of this brainy, soulful kind of experience, which I think that feel really comes out.
Well, I mean, that's a combination of, your connection and then Adam's ability to direct you so well, and then my nerdiness.
It's a emergent phenomenon of all of the above. But what you were pointing at, I think, is that transcendent period in the pandemic when that was happening. Now, I'll follow up with this as one of the last things maybe we talk about, unless you want to go and talk about other things, because I'm open to that too. But has that changed, my brother? In this fourth wave or whatever we're in, because I hear from nurses and doctors, they're like, I'm done, I'm ready to retire, I'm finished, this is too much. Whether they're frustrated with people who aren't vaccinating, or they're frustrated with just the amount of paperwork that's back, or whether they're frustrated with the volume, or they're just tired.
And my cell phone blows up daily with doctors who are just done.
Yeah.
There's amazing statistics on suicide and whatnot. And I do think it's different now in the sense that it reminds me of that scene in The Grace of Wrath where Steinbeck talks about, is the greatest evil what happens in war where you see heroes come out, or is it happen in peace when we're not paying attention as much? And he's got that image of the turtle crossing the Route 66 in the middle of the desert. And yeah, I think right now, I would say physicians, healthcare workers are suffering more than even in the pandemic because their purpose is not clear. And that's hard on the soul.
I am with you on this. That's what I'm hearing and feeling.
Mhm.
And, you know, I mean, sometimes, you know, Dr. Wes Ely came on the show and was talking about this. His piece will come out shortly. Sometimes you just have to step back for a second and reorient. And there's no shame in that, right? Our whole thing is like strong work, you know, like would you man up, be a wall, all the other militaristic talk that we do.
And I would say is, you know, as an emergency physician, our stress release is to dive in. And to say to an emergency physician, it's time to back off a little bit, get your head down. They're like, that's what I've been running away from my whole life. What, are you kidding me?
Yeah.
You know, it's so disempowering.
Yeah.
And really very hard. I was sort of forced into it, but really hard to share some of that with, you know, my colleagues and other people in the field.
Vulnerability among doctors sharing with each other is a tough one. Why is that? It's just our culture. I mean, I talked to Robbie Pearl about it on the show. He was saying our culture is to deny, project. It's how we're trained.
Accuse, blame, criticize, deny.
All the others. Yep. You name it. I've done it.
Wait a second. Doctors are supposed to be, you know, godlike figures of healing.
That's right. The way we get our godlike powers, Gary, is we project blame on others and we deny any of our emotions.
Oh, nice tip.
You're welcome.
No, but I mean, we're trained, though. I mean, as a pediatrician, you're trained to look at a child not as a baby that you need to cuddle, but as a potential harbor of disease that you need to identify and cure, because why else would you stick a piece of metal in an infant's back?
Yeah.
Right? You can't do both in 1 minute.
Yeah.
And so we're put the humanity aside so that we can do extraordinarily violent things to help save people's lives. But that isn't the way you live life.
Right.
You know, so.
Right. Sometimes you just need a support group, man, like Schwartz rounds or something where you just sit and process it. And I think hopefully now this will wake us up a bit. Right. And that's another reason I love the documentary is like you come away feeling awake. Like you're like, oh, that's what this pandemic, if we had a memory of the pandemic, because, you know, we've forgotten a little bit the early parts of the pandemic, the fear and the craziness and the social contagion of fear and all that. It gets reignited a little bit when you drop right back into the beginning when you're talking about, we didn't know what was going on. And then we had this tent, we started this, and you see, you know, the docs are out there talking about it. It's powerful.
And we use the news that was evolving over the first 6 months of the pandemic. And we keep kind of bringing you back to these TVs that happen to be in the corner of the waiting room at the hospital or in somebody's bedroom. And you hear like, oh, it's, you know, June and this is happening. It's September and 200,000 people have died. And, you know, we walk you right through it.
I thought the best clip, though, is when it's national news that 6 people have died.
Oh, that's
right.
I was
that.
watching that a few days ago. And I was like, whoa, there was a time when
that was international news.
Yeah. International news. And, you know, the other thing I want to compliment you on is that there was no sense of political agenda in the movie because people are sensitive to that. You know, it's when if we talk about public health, immediately we'll be branded as some kind of lefty communists who want to shame people into wearing masks. Whereas it's not how you have to talk about it. You can talk about it as it is, which is here's the data, here's the science, here's the emotion, here's how it feels. At no point in the documentary are you like coming at people in any way, one way or the other. You know?
I think, you know, people say, okay, we didn't learn anything from the 1918 pandemic and all that. I think if we went back and talked to the public health guys from 1918 and said, what's the lesson that we should learn? They'd say, it's going to be really hard.
Yeah.
It's going to be really, really, really hard.
Yeah.
You're going to try and say one thing and people are going to do the other thing. It's going to be a mess.
And wear masks.
And they'll say, wait till you get the anti-masker league, right? Wasn't that the 1918?
Right. Yeah. I want to thank you for noticing how balanced it is and how we don't take sides because that's how we speak to everybody.
Right.
And it's also something that in your work was one of the reasons why I've wanted to reach out to you because you're just pretty devoted to not taking sides.
The alt middle.
Yeah.
The radical high ground middle. Where you kind of look at all sides. Yeah. And that doesn't mean you're a centrist. It just means you see good in all the people, people's ideas, and then you see everything as a little bit true but partial. Something's a little more true and less partial, and you try to advocate for those, but you do it in a compassionate way.
And that's not easy to always do. I mean, not for me either.
I fail a lot. Yeah,
I fail as well.
Yeah, I fail a lot because the emotions, and sometimes, as a scientist or as a doctor, you just get passionate about stuff, right? Like when I saw your piece, I was like, man, I want to do a show right now telling people, just go get the vaccine. Forget about all this misinformation. Just shut up and get the vaccine. Just shut up and get the vaccine. No, I'm not taking any dissent. And then I realized that's not, again, I was like, do I even really feel that way? No, people need to ask questions. They need to process it, and they need to come to their own decision that's right for them and their family, which means we give them our opinion too. Like, hey, if you were my loved one, I would worry about you day and night until you got vaccinated. Right?
Mm-hmm.
Man, what a joy. It's so cool to hang out. We rarely do this kind of I was going to call it a three-way, but it got creepy, Yeah,
I made him get a PCR test before he came down here today.
People don't understand Gary. If you heard Gary's medical history,
it's complicated.
Oh man, every single doctor who's watching right now, if I told you Gary's history, it'd be this thick, and your jaw would drop. Like, he's been through hell.
No, I'm a super healthy guy who just had some stuff that happened to happen. Whatever.
When you were younger, informative.
Yeah.
And my favorite part of your story is while you were recovering from like having a lot of your can I tell any of this story?
Not really.
Okay, then I won't. While you were recovering from being sick, I can't even tell can I tell the Atari story?
Oh yeah, you can. You can
so he's recovering from getting sick.
This is back in 1982.
82. I'm trying not to violate HIPAA. And so I'm talking to the patient. I'm like, can I say this, right? Could you imagine, like, I get a summons, like, after an interview? So he's recovering, and he's like, I don't know what I'm doing with my life. I'm young. I've had this thing happen to me that's going to probably change my life for a bit. I'm really fascinated about what these guys at Atari are doing. I think it's really interesting. He writes a letter, because this was 1982, types up a letter to the CEO of Atari. Who was that?
Raymond Kassar.
And it's like, I don't know, you don't know me. I'm this kid who had this stuff happen. I'd do anything for you. I'll be a gopher. I'll get you your coffee, whatever it is, but I just really want to work with you. I'm passionate about it. Sends it off. And then a couple months later or something?
Yeah, he made me a grantee with the Atari Institute for Educational Action Research. And I was like the grantee who was the homebound, recovering sick person using microcomputers to do things remotely. I was like the perfect test case for that. They were working on a project like that.
Wow.
And that's what launched me into the field of software design.
While you were doing that, I was playing Pong, okay, and crushing it. Oh, man. Gary, Josiah, this has been a joy. We will put links on how to get and watch the thing on Oculus. I'll put a link to the YouTube 2D non-stereoscopic version, which don't judge it by that, but you can get a sense. And for people who are interested in working further with you on this educational component with funding and things like that, I imagine there'll be links on the website on how they can contact you.
Sure.
Yeah. Perfect.
Absolutely. And on the COVID-19 website for our film, there's a learn page which people can go to discover some of the molecular biology. I break it down, and you can learn actually quite a bit.
Oh man, that's awesome. It's a great website too. Yeah, I love it.
And that's my other plug is I do work with folks who are recovering from COVID and work with them. I was a track athlete in college and whatnot, a musician, and help people with all the things that I went through. And I put Gary through the training program, and he's hiking 16 miles a day nowadays. So
wow,
it's pretty cool.
That's awesome. How can we find that? You got a website?
We do. It's called Songs for Life.
Songs for Life.
Songs, the number 4.life.
Yep. Okay, so we'll put that link in too.
Yep. So we've got some opera singers who are working with folks and do pretty cool stuff.
Can you help me sing better? No, let me rephrase that. Can you help me sing, period?
Yeah. Do you know that the common myth is that, you learn perfect pitch in childhood, but if you give somebody Depakote, they can learn it as an adult?
No way. The anti-seizure medicine, anti-bipolar med Depakote?
Go ask Dr. Google.
Dr. Google says I can get perfect pitch with Depakote?
You got it.
Dude, I'm totally willing to get a pill rolling shuffle. If I can,
I have to say the corollary to that is that having perfect pitch, which I don't have, but I know people who have it, is a kind of a curse.
It's a curse, yeah.
Yeah, because there's all sorts of things that are microtonally out of pitch, and it drives you
Drives
insane.
you nuts.
So I say hold the depth.
Yeah, unless you're like Jacob Collar, and then things get better.
I will just be happy with relative pitch. I don't even have that, according to anybody who's listened to me sing. All right, guys, this was a joy. Share the video. Check out the links. This is the future, I think, of education, public health, entertainment, all of it, and I'm won over. Gary, thank you for reaching out. Josiah, thank you for coming post-shift. And I love you guys. We are out. Peace.